Hi, hello everyone. Welcome to Dr. Ravichandra Official. Please like, share, and subscribe Dr. Ravichandra Official for more interesting videos on pathology. In this video, we will discuss breast tumors. We have benign breast tumors and malignant breast tumors. Self-examination will prevent the breast tumors to progress. That is the best idea or suggestion that can be given to each and every person. Coming to the breast tumors, first we will do FNACs, and if there are benign, the separate treatment, and if they are malignant, separate treatment are advised. So the FNAC are confirmed by histopathology. Coming to the breast tumors, there is one tumor called as breast mouse or fibroadenoma breast, which is a very well circumscribed lesion, well defined, freely mobile. It can be present in all the quadrants, and it will show MED12 mutations. On FNAC, when we do FNAC in the breast mouse, we will be able to appreciate on microscopy Stag-Horn clusters of cells. This is the characteristic feature of this breast mouse or fibroadenoma. Coming to the histopathology, fibroadenoma is a stromal tumor and it is a benign tumor. Radiologically, it can show a popcorn calcification, and on biopsy, you will appreciate two types of patterns. One is intracanalicular pattern and the other is pericanalicular pattern. In the intracanalicular pattern, the myxoid stroma will compress the ducts into slit-like spaces, whereas in pericanalicular pattern, the abundant stroma will surround the patent or dilated ducts. That you can easily appreciate in the above picture shown. First one is Stag-Horn clusters seen in breast mouse FNAC, and second picture is intracanalicular pattern of fibroadenoma, and the third picture is pericanalicular pattern of fibroadenoma. Coming to cystosarcoma phyllodes or phyllodes tumor, this will arise from intralobular periductal stroma, and don't you have to remember one point, this is not coming from fibroadenoma, it is arising from intralobular periductal stroma. There will be leaf-like appearance of this tumor. That's why it is called as phyllodes tumor, and it occupies the entire breast. That's why it is called as cystosarcoma phyllodes, as there are spindle type of cells. It can be benign or borderline or malignant. Benign tumors will show MED12 mutations and malignant tumors will show FOXB13 mutations. Coming to the breast carcinomas, there are many factors that are called as risk factors or prognostic factors that are showing their impact on the breast carcinoma. You can say like that. So the risk factors that are increasing age, that is, it will be more in 60 to 70 years females, and more than that age, there is increased risk of breast carcinomas. Prior radiation exposure will lead to breast carcinomas. BRCA1 and BRCA2 are related to familial breast cancers. ER, PR, and HER2/neu receptors presence will show good prognosis, and ER, PR, HER2/neu negative, that is triple negative breast cancers, will have a poor prognosis. And prolonged reproductive life, nulliparity, late age at first childbirth, and giving less breastfeeding for a short duration, or exogenous estrogens exposure will all act as a risk factors for breast carcinomas. And obesity in younger age is protective, but whereas postmenopausal increased weight, that is obesity, will lead to breast carcinomas increased risk. And coming to the major prognostic factors for a breast carcinoma are lymph node metastasis, locally advanced disease, inflammatory carcinomas, tumor sizes, distance metastasis, invasive carcinomas, RSS, in situ disease. When a patient, when a patient comes with a classical history of a breast swelling, or there is a discharge from the nipple, or when there is a purely orange appearance of the breast, then it is characteristic of breast carcinomas. This purely orange appearance, that is like orange peel appearance of the breast, is because of the lymphatic edema, cutaneous lymphatic edema. Okay, these breast carcinomas are classified molecularly and histologically. Molecular classification of breast carcinoma based on gene expression and profiling. It is divided into luminal type, HER2 positive and triple negative breast cancers. Luminal type are further subdivided into luminal A and luminal B. Coming to luminal A, ER positive, PR positive, that is estrogen receptor positive, progesterone receptor positive, and HER2 negative, Ka67 positive or negative. Here the involvement is BRCA2 mutations and PIK3CA mutations. This will cause the breast carcinomas. And the histological types that are coming under the category of luminal A will be tubular, mucinous, papillary, and low-grade invasive lobular carcinomas. Coming to the luminal B, ER positive, PR positive, HER2 negative, and Ki67 positive or negative, BRCA2 and PIK3CA mutations are involved, leading to the breast carcinomas. In this luminal B type, high-grade invasive lobular carcinomas will come. The high-grade invasive lobular carcinomas are bilateral, multicentric, and they will show Indian file pattern, which is characteristic of invasive lobular carcinoma. And this invasive lobular carcinoma is because of the decreased E-cadherin. Coming to HER2 positive, they are around 10 to 20%. The mutations will be TP53, and here HER2 amplification is there, thereby resulting in these breast carcinomas. The histological type of breast carcinomas that will come under HER2 positive will be apocrine carcinomas. Coming to triple negative breast cancers, their BRCA1 and TP53 gene are involved, mutations are involved, and these triple negative breast carcinomas will have the poor prognosis. The histological types that come under the category of triple negative breast carcinomas are medullary, metaplastic, adenoid cystic, and secretory. Coming to one more terminology, that is Paget's disease of nipple. The patient will come with a complaint of discharge from the nipple, and that is further progresses into breast carcinoma. The Paget's disease of nipple differs from other skin diseases is there will be involvement of the nipple first, then followed by the areola in Paget's disease of nipple, whereas in other skin diseases of the breast, you can say it, areola is first involved, then nipple is involved. So in Paget's disease of nipple, which is also called as mammary disease or Paget's disease of breast, here there will be bloody discharge from the nipple. The characteristic feature is first nipple is involved, followed by areola. This is very, very important related to Paget's disease of nipple. So thank you for your patient listening. Please like, share, subscribe. Dr. Ravichandra Official signing off.